affected. Yeah.
We have some questions coming in there from Ennis, from Dr. Pierce. Any update on the 25 extra medical beds for Ennis?
Well, you might update me, Dr. Pierce. Did you put in a bid for 25 extra medical beds? I know you talked about it at various times we met when we were out at the site, but I don't see any bid in for it, but I'm due a visit out to the sites anyway, so we can have a chat about that and see how that would work.
We're looking at the next question. Would the CEO support a health and safety officer on sites? There's extra regulation and oversight now from the HSA and others.
Yeah.
Would we support extra resource in there on other sites?
Good question as well from Ennis, and we were just thinking about that over the last few months, because you're quite right, there's a lot more audit going on and a lot of things that we have to deal with, and we've really, our health and safety arm is really too small, and we can't be leaving it to staff to be risk assessing every minute because they're too busy. So we are trying to develop a health and safety arm and department, and we will look at that the sites have a person that is skilled in that area. They can do training as well, get access to training, and would be your rep for your site then. But we just have to map it out somewhat and see what that would look like. So John Doyle has been holding the reins in that for a while, and Mairead. So we just need to see, can they give us some direction on it, but I would encourage you to link in with him to see what that plan would look like.
And another query then from Ennis, Colette, is, are there any plans to introduce Wi-Fi? That's a very specific question. I've no clue.
Yeah, I know we had problems with Wi-Fi. Of course, there should be Wi-Fi everywhere. So some of the problems we came up against, I don't know if it's in Ennis as well, Joe, but the walls were too thick, would you believe, in some of the sites to put in even the Wi-Fi properly, the cabling system, and we had to put in boosters and lots of things. But there is a plan that was dealing with that. We were trying to deal with it in the maternity as well, because a lot of professionals need Wi-Fi access. So you'll have to give us more intel on that, but there is a significant change coming in the service of e-health in the coming weeks, so we can table that as an issue. I actually thought Wi-Fi was corrected, so you'll have to give me more intel.
Okay. New theatres in Ennis. Is there any update on that?
Yeah. There is, in the sense that we know your theatres aren't fit for purpose, and that we have to put a plan in place around it. So there's design starting on that, and Joe and the team may have already been involved in the design discussion, but he can speak to that to these people. But there is, it's there, it's in the plan. We have design funding for it, but of course we have to go after the actual funding. But it's always good to have it in the plan, and it's very hard to get such things in a plan. So we just have to work towards it, and that'll take some time, and a feasibility study, a gap analysis, and all the resources needed. So we can start working on that with the states. Do you have a good idea in your head? And I think it's an L-shaped structure you're thinking of, and a lot of changes as well as the theatre. There's other buildings within that.
Okay.
Yeah.
And thanks, Marie, for that question. I think Joe has come in there to comment there on the design phase as well.
Yeah, thanks, Joe.
We have another question coming in here from Nenagh, and it relates to security on site in Nenagh. The hospital is expanding, service provision increasing, so there's greater public footfall throughout the day. At the moment, security is on site from 8 p.m. to 8 a.m. and Bernie out in Nenagh is wondering, do we have any plans to increase security cover across the day?
Yeah, so as Bernie knows, there's a business case in on that, and was brought to the EMT some weeks ago, and I've asked them to hold it because we're reviewing. We hired a lot of security in UHL during COVID, because there were so many access points, and we had a lot of difficulties per se with footfall through the unit. So we're reviewing our security numbers, what they're doing, and then we'll take a focus on the group wide. Can we reassign some of those? Some of the posts won't be used anymore because they won't be COVID funded. But the business case hasn't been ignored. I just paused it until we had that review done. So we will come back to Katrina and Bernie on it, Nenagh, presently.